One.
Yeah,
Okay,
go ahead.
Oh, there you can hear. Yeah, great. This is Malik Khan, licensed acupuncturist, herbalist, and nutritionist. I'm interviewing a colleague and a friend from the UK, and he's not just a normal acupuncturist, I'd say. He's one of the best top acupuncturists in the UK. His name is Professor Dr. Wang, and he's a consultant acupuncturist based in East London. And his website is tjacupuncture.co.uk. Have I got that right, Professor?
Yeah, correct.
Excellent. Professor, you've got a beautiful scenery in the background. I wish I was there as well. I'm sure all the viewers were there.
Me too.
Excellent. Okay, we're going to start off with, you've got an extensive amount of experience and specialist experience in particular in TCM. Can you just share some of your background with us, please?
Okay. Originally I was from China, Nanjing. After the 5-6 years university education, as both Western medicine and Chinese medicine. As you know, in China, all of these TCM acupuncture doctors should be training as a medical doctor, both Western medicine and Chinese medicine. After 18 years practice, education, and research, then I moved to the UK. Was employed by the University of East London as a senior lecturer and the director of a acupuncture clinic for 7 years. Then after university, I started my own business in East London, which is a TJ Acupuncture Clinic and TJ Acupuncture Academy for acupuncture practice, education, training, etc. Yeah. My major interest or practice are the Chinese medicine acupuncture for the brain-related conditions, including neurological diseases and psychological diseases as well, particularly for scalp acupuncture. Yeah, this is my briefly background.
Okay, excellent. Yeah, scalp acupuncture is a very unique skill set. And I know a lot of acupuncturists know a little bit about scalp acupuncture, but they don't know as much as you do. Now, can you tell us how many years, or more importantly, how much success you get with, and what conditions you treat with scalp acupuncture?
Oh, yes. Scalp acupuncture, as you said, it is a very unique technique in the, particularly we call the modern acupuncture. And for myself, I studied scalp acupuncture as partly of my curriculums in university from 1985. So which means about 36 years, I studied and practiced scalp acupuncture. In China, it's very common, but in the Western countries, when I moved to the UK as a senior lecturer in the University of East London, and also other communities with other Western colleagues, I realized this is a very, very, we say, real the technique which is introduced in the Western countries. One of the reasons is this scalp acupuncture are mostly practiced for the on the scalp, on the head, for the neurological and psychological diseases. In the briefly, we call this a brain disease, but this area is not so common, introduced to the Western countries, because this is quite a new area, even in China. Although in the Huangdi Jing time, 2000 years ago, brain has already been discussed, but some reason it was lost for about nearly 2000 years.
Lost,
only,
hidden.
Yeah, lost. Yeah, the brain, TCM brain knowledge has been lost, has not developed in about the nearly 2000 years. Only from about 30-40 years in China, the new developed on the TCM brain knowledge and the technique are developing very quickly, particularly including this we call the scalp acupuncture. But for the most Western lectures or the Western textbooks did not familiar with this area. So most of Western lecturers and practitioners are not so familiar. So after I moved to the UK, I start to introduce TCM brain knowledge and technique, including scalp acupuncture for university lecture and other seminars, conference, including several times on the BACC conference. I introduced TCM brain theory and scalp acupuncture.
Excellent. Good, excellent.
Yeah.
So with what kind of conditions, neurological conditions, can scalp acupuncture help with? I assume MS, motor neuron, okay. Yeah, those sort of things?
Yes. MS is one of the typical cases. In some samples for neurological diseases, scalp acupuncture can benefit, including but not limited. First, in China, as you know, stroke. Stroke is the most common problem treating scalp acupuncture in China. And also in the Western, I use the scalp acupuncture to treat many stroke patients as well. But also lot of other neurological diseases, such as dementia, Parkinson's disease, brain injuries, MS, the children's autism, and etc. So there are many similar conditions in this area, and scalp acupuncture are very effective. Yeah.
Okay. Now, Professor, sometimes people say that they've had a condition for maybe 10 years or more. Can scalp acupuncture still help them? Because some acupuncturists say, "Oh no, it's too late. You've left it too late," and they, don't give them hope or lose hope. And
I understand. Yeah, I understand your question. In general speaking, we all know delayed treatment, it is challenge or difficult than early stage. It is true, but still possible. Such as for some of the stroke patients, some of the we say MS patients, they are still benefit in some area, but not we can't stop the process possibly, but they are still benefit for the treatment, particularly if we plus scalp acupuncture. So they are still possible, some benefits.
Yeah, I remember speaking to a neurologist many years ago, and he was saying that the brain, once it's lost certain cells, don't grow again. And we've now, the latest research has come out that the brain is very neuroplastic, meaning it can regrow. So the common thread that they've had in standard Western medicine has been that once you lost the brain cells, that's it. But they've now found that it can grow again. So I think the acupuncture, especially the scalp specialist acupuncture, which you use, okay, because I know there's a particular style of acupuncture, the scalp acupuncture, different styles. But the one you used, and I've read that book as well, by Jason Howe.
Yes.
I've got the book somewhere.
We are friends. Jason Howe is one of my good friends.
Yeah, it's a fantastic, system, and the key thing which most patients are looking for is, it's not just hope, but we're looking for is some results. Now, can you put your hand on your heart and say you do get results? Good results.
Yes. But of course, as we all know, their result is result, but this result is not, of course, as good as early stage.
Yeah.
But still, in early stage we can do 80%, 70%. But in the later stage we can do 50%, 30%, 20%. They're still working. Yeah.
Which is amazing, and which is a great, massive benefit compared to the alternative, which is drugs, or or just more drugs and leave them to die slowly, kind of thing, and in pain.
You are absolutely right, and also I totally agree with you. The traditional Western medicine, they thought the brain cells just died. There's no any hope. But now there are many, even from the Western medicine, there are some new research, as you said, they can plus the new cells in some part. And also another theory, they believe, we brain has lots of cells are not active. We only active 10%. which means there are another 90% can be reactive. So that means when we use scalp acupuncture, not only we neoplastic the dead cell, but also we stimulate or active the sleeping cells, sleeping areas. So this is another mechanism why scalp acupuncture can help this kind of patient even after several years.
This is amazing, and I wish really more people know this, and more people, try it out. At least give it some, a chance to try it out, and it's not just a case of wishing. This is hoping, and then this, if it doesn't work, it doesn't work. But there's no side effects compared to side effects of drugs. And we know there's many side effects, and we know that the success rate isn't that high either in alternative, Western medicine and drugs-wise. So this is brilliant news for those sufferers. And I know, so we spent quite a bit of time with this particular brain sort of area, which you're amazing, you're very effective with. And you also do many other conditions as well.
Yes.
What other condition could you do to help with? Some low back pain?
Oh, yeah. And of course, for some general acupuncture, it is widely common, accept we all understand, such as general acupuncture for many pain conditions. And for the chronic pain conditions, as you know, I also often to add scalp acupuncture as well. Okay. Because these chronic problems, many of them have some brain involved. There are some areas, some cortex in the brain has already impact. This impact can be temporary or some disorder of these chronic problems as well. So I also commonly use scalp acupuncture for this kind of pain as well, such as the low back pain, neck pain, etc.
Excellent, excellent. So you apply the traditional acupuncture, and you also apply the certain, like I guess, on certain motor neuron areas of the
yeah. Sure.
And you have very good results with that. Yeah.
Yes, but only the difference is some conditions I use for body acupuncture similar to other colleagues as well, such as for tennis elbow, shoulder pain. Of course, I put some needles around the local area. Yeah, the only difference is I add, because of the brain mechanism, whatever from Western medicine and Chinese medicine, I also add the scalp acupuncture, some scalp acupuncture as well, such as, we call the sensory area, we call the foot motor sensory area as well. So this is different. But if for the neurological or psychological diseases, I will majorly to use scalp acupuncture as the key treatment.
Excellent. And people always say, patients always say, "Oh, will it hurt?" I mean, I asked someone once, they had loads of tattoos on, and I asked them, "Is a needle more painful? What's the difference between the needle of tattooing when they have tattoos and the acupuncture needle?" And he said that the tattoo needle is 100 times or more, many times more painful than the acupuncture needle.
Yes.
So people shouldn't worry about, there's going to be a lot of, the fear of a small, very thin needle going to them.
Sure.
And when it's going in the head, because in the head, there's not very much skin.
Yes.
So is it painful?
Yeah, okay, it's a good question. This is also a common question I'm asked by many colleagues and also patients as well. And in general speaking, it is possible painful than body acupuncture. It is possible if without proper training. Yeah. But if you got proper training, even less than traditional acupuncture. Because as you said, they are less muscle. So that means they are less sensitive on the muscle aspect. So if you got a special training, I often use scalp acupuncture very quick, just quick. Like sometimes we call flying needling, very quick. Many patients even never noticed, needle always in. And also I use scalp acupuncture for very often for children. such as autism, such as cerebral palsy, even for the eczema. I use them on the scalp. Many children, they even did not notice the needle. When they play the games, they work with games, they put needle in. That's it. They didn't notice even. So that's sometimes even it is more effective or more convenient than body acupuncture, particularly for children.
Excellent.
Excellent. Yeah, thank you.
That's very good for all those that hearing, and especially if they have children. That it's less if it's in the hands of a specialist and one that cares as well. There are some people I've come across that that are specialists, but they're not very caring. Okay, so if you find a specialist and a caring one, and you can, the experience is much better and the effect is much better.
Yes.
So it's not just. So that's brilliant. That's good. So the children can be well, sort of like happy with this process as well.
Yes, yes. I have many children patients with me, even with several months or 1 or 2 years, they already received acupuncture treatment in my clinic. Yeah, most of them are very good.
Brilliant.
Okay.
Excellent. And the other things that, so you do traditional things like back pain, elbow pain.
Oh, I'm sorry.
It's okay, it's right. So,
sorry, got a call. So hopefully, yeah, I can start.
Okay, so as back pain, you deal with elbow pain, headaches,
yes,
skin issues,
yes,
and anything else which a normal acupuncturist will do, you do, but probably
yes.
better, right? Without doubt.
Yes. Yeah, thank you. After 30 years experiences, and also not only practice, and also, I'm a professor. I got a lot of teaching, and also I got research, such as my special research on the brain, which start from my, the PhD research on depression, so acupuncture for depression. So I did a lot of research and published many papers. So that's the reason my knowledge could be possibly a little bit wider and deeper. So that's something. But the general conditions, I think the body acupuncture are very similar for many other the colleagues.
Excellent. Now you do herbs as well.
Yes, I do herbs as well.
Okay, so you combine acupuncture, herbs, and cupping.
Oh yeah, and as you know, in China, and as TCM doctor training, it's very similar to the medical doctor in here. We do 5-6 years training with both Western medicine and Chinese medicine, and also Chinese medicine. There are many different therapies, and the major one first herbal medicine, then acupuncture, and also the cupping is partly of acupuncture, and also we do twin massage. And the technique you saw in acupuncture, we do the needle bleeding, the plums of needling. We do electroacupuncture. We do the other abdominal acupuncture, wrist ankle acupuncture, ear acupuncture, electroacupuncture as well. So there are many different methods. We can choose which one are more familiar with myself, and which one are more benefit for that patients.
Brilliant. Okay, so if a patient, if a patient wants to contact you for an appointment, yes, what would they expect from the first treatment?
And
how long would it be?
Some patients, they are not so familiar with acupuncture. It's possibly the first time for them in their life, so they don't know. Some patients they have already heard about acupuncture, or themselves, their friends had already received some acupuncture treatment. They have some idea. But one of the common questions, as you asked, is how long may I expect to see the result, etc. So most of I would say it depends. It depends on how severe it is. If you're acute lower back pain, if you're acute stiff neck, possibly 1 session, 2 sessions, finish. But if you're chronic problem for many years, of course you need some treatment, more continued treatment. But based on my research, I did a lot of the clinical research, and including some of the MyMop research, etc. I believe you learned about MyMop. So average speaking, most patients, they will notice some clinical benefit around 5 sessions for chronic problems. So I can tell them this is based on the clinical evidence by the clinical research. This is average speaking.
And the first session, is that 1 hour or 1.5 hours or?
Oh, in terms of time, so this is quite diversity for different style, different different practitioners. For myself, for the first visit, most of the time, well, mostly will be about around 55 minutes to 1 hour. And because this is including the consultation, normally I do consultation first about 20, 30 minutes, but this is extra charge. Then I do treatment. So all the following sessions for me in my clinic will be in total 30 minutes. I know some practitioners, they do 1 hour, 1.5 hour, etc. But this is different style.
Yeah, true. Excellent, excellent, excellent. So great. So as we're coming up to our time, allotted time. So if someone want to wrap up, so if someone wanted to contact you for an appointment,
yes,
how do they contact you, Professor?
First, you know, you go to my website, the TJ Acupuncture. You just search Google on TJ Acupuncture, you can find my website. And also, of course, you can contact me through my the email info@tjacupuncture.co.uk, or my my number is 07515695369. This is my clinical number. You can always contact me through email, through my number, etc. More than welcome to contact. Colleagues are also welcome to contact me for cases discussion, for any training or any workshop, etc.
Okay, excellent, lovely, excellent. It's been a pleasure talking to you, Professor.
It's my pleasure for the interview. Yeah.
And I hope we can have another time in the future, more development in this area.
It's hopeful. I'd like to communicate, contact with other colleagues like you as well.
Brilliant, lovely. Okay,
yeah.
I'm just going to end this call right now. So we'll just stay on the line a second.
Okay.